Hello, my name is Suzanne Cardosi. I am a student nurse practitioner at Northern Kentucky University, here to do a physical assessment. Could you please, vital signs and history have already been taken. Hi Courtney, my name is Susie. I'm going to be starting with just some orientation questions, okay? Can you tell me your name and date of birth, please?
Courtney Marciano, December 7th, 1990.
Yep, and what is the year?
2019.
It sure is, and who is our president right now?
Donald Trump.
And why are we here, Courtney?
For my annual wellness check.
Okay, great. Are you having any pain right now?
No pain.
Okay, great. I'm just going to kind of do a head to toe. If you have any questions at any point, stop and let me know and I'll answer them for you, okay?
Perfect.
We're going to start with looking at your head. I'm going to pop at your scalp a little bit and look for any lesions or any tenderness, okay?
Okay.
Looking at your scalp, skin looks good, hair looks good, well distributed. Any pain while I'm feeling your head?
No pain.
Okay, great. Head is normocephalic, looks great. Now I'm going to take a look at your eyes, okay? If you could just look straight up for me, take a look at your sclera, great, and then straight down for me. Okay, perfect. Now if you could just follow the tip of this with just your eyes and not your face, okay? Do 3 more on the other side. Perfect, okay. Now I'm going to bring the tip of this straight in towards your nose, okay, and just follow it with your eyes. I feel a little funny. Perfect. All right. Now, Courtney, if you could just look straight forward at me, I'm going to shine a little light in each of your eyes, okay, and check your pupil red response. Perfect. Pupils are equal, round, and reactive. Courtney, now I'm going to just do a little vision test. I have this eye chart. I'm going to hold this 20 feet away from you, okay? First, we'll start with both eyes open and read the smallest that you can.
P-E-Z-O-L-C-F-T-D.
Perfect. Now close your right eye for me and read with the left.
P-E-Z-O-L-C-F-T-D.
And do the same on the other side.
P-E-Z-O-L-C-F-T-D.
Perfect. Vision is 20/20. Courtney, do you wear glasses or contacts? Okay.
No.
Now we're going to do a little test where I'm going to hold my finger right here. You're going to do your nose to my finger, okay? Okay. Okay, go as fast as you can. Now close your eyes and keep doing it. Perfect, great job. Okay, now I'm going to take a look at your ears. Kind of just feel those out. We'll do a little hearing test. Going to kind of just palpate, look at your ears, any pain or tenderness on the external area. Okay. Take a look inside there. Perfect. Pop around to the other side. Awesome. Now, can you hear me? Both at the same time. Perfect. Okay. This may seem a little silly and kind of funny, but we're going to do a tuning fork. I'm going to make it vibrate and put it on the top of your head, and you tell me if you can hear it equally in both ears, okay?
Yep.
Can you hear it both on both sides? Okay, great. Now I'm going to do it on the back of your ear. You tell me if you can hear it, and then which one is louder, okay? Okay? What was louder? Awesome. Go do on the other side.
Here. Second louder.
Perfect. Courtney, I'm going to take a look at your nose, palpate your nose, any pain or tenderness in there, okay? Tilt your head up for me. I'm just going to take a peek inside there. Awesome. All right, now close one of your nostrils, breathe in. Awesome. Do the same with the other. Perfect. Next, we're going to look inside your mouth real quick. Just open up your mouth for me, say ah, ah, okay? Mucosa looks pink and moist. It's intact. There aren't any lesions. Teeth look good. No missing teeth. Stick your tongue all the way out for me and say ah. Okay, tonsils look great. No swelling or anything in there. Now I'm going to take a look at your neck, okay? I'm just going to palpate some of the lymph nodes. Any pain. Okay, no swollen lymph nodes here. Any pain here? Okay. Check your thyroid. Kind of move it over a little bit. Okay, perfect. Anything feel funny? Okay. Now, Courtney, if you could look all the way up to the sky for me. Go side to side. And then do chin to your chest for me. Any stiffness or anything with that? Any pain? Perfect. I am also now going to listen to your carotid pulses with the bell of my stethoscope, okay? Now, if you could take a deep breath and hold it for me. Perfect. You can breathe out. Do the same on the other side. Deep breath. Perfect. And no bruits were assessed. We're just going to palpate your carotids while we're on it, okay? Feel a little pressure. Same on the other side. Okay. Feels good. Strong pulses. Now, Courtney, I'm going to take a look at your chest, okay? I would visually inspect the chest wall. I would percuss the chest area. Okay. I am going to take a listen to your lungs, okay? So just take a deep breath for me every time you feel the stethoscope on there, okay? And we'll have to do it quite a few times on each side, okay? Now I am going to do the same thing on the back, okay? Okay, now Courtney, if you could lift this arm up for me, we're going to do, awesome, I'm going to palpate your nodes in here, any pain or swelling. Okay, do the same on this side, lift this arm up for me. Deep breath. Okay. Lungs are clear and equal bilateral, symmetrical rise and fall on each side. Okay. Now, Courtney, I am going to go ahead and we'll have you lay down here in a second. First, I'm going to listen to your heart, okay? Listen to it in 5 different spots, okay? And at the apical position, I would listen for a full 60 seconds. Okay, great. S1 and S2 are heard, no murmurs or gallops, okay? I'm going to go ahead and flip it around and listen for any aortic pulses, okay? Okay, perfect. And now, if you would, I'm going to do an assessment of your abdomen. If you could just hop up on the table for me real quick. Okay. Now first, I'm just going to visually inspect the abdomen. Sorry if my hands are a little chilly. Looks flat, non-distended. Skin looks good, no lesions present. Skin is color of ethnicity. I am first going to take a listen to your bowel sounds. Okay, Courtney? I'm going to do it in all 4 quadrants. Okay. Bowel sounds are active and audible in all 4 quadrants. I am going to listen to aortic pulse. And move over and do the renal arteries as well. Okay, perfect. You doing okay?
Mm-hmm.
Okay. I'm going to palpate kind of lightly, and then we'll go a little bit deeper, and you tell me if you feel any pain, okay? Any pain, tenderness? Okay, cool. Okay, soft, non-tender. I'm going to percuss. Okay, perfect. Or you can go ahead and cover up, and I'll have you say that for me, okay? Alrighty, we are almost done. You're doing awesome for me. I'm just going to take a look at all of your extremities now, okay? Kind of do some range of motion and some strength testing. So I'm going to palpate and assess your extremities. No swelling. Is there any pain or tenderness? Okay, skin looks good, appropriate with the ethnicity. I'm going to go ahead and palpate your radial pulses. Okay, +2, normal rhythm. Bilaterally. I'm going to check your cap refill on each finger. It's less than 3 seconds. Fingers are warm. Appropriate skin tone. I'm going to go ahead and check your reflexes on your arm, and that is in my pocket. Okay. Good. Come over here and do it. Perfect. Okay, Courtney. Now, if you could squeeze both my hands as hard as you can. Awesome. Okay, kind of go like this and pull up towards you and push back towards me. Great. Okay, and while I'm thinking about it, just go ahead and raise your arms up as tall as you can. Awesome. If you could turn from side to side. Great. Any pain or swelling there? Okay. I'm going to go ahead and take a look at your spine. Assessing the back. Skin looks good. Any pain or tenderness down along your spine? How about your lower back?
Nope.
Okay. Now I'm going to place my hands on either side, and every time I put my hands down, you say 99, okay?
Okay.
Okay.
99.
Perfect.
99.
Perfect.
99.
Okay, awesome. Alrighty. While we're on your upper extremities, I'm going to go ahead and do some sensory sensations, okay?
Okay.
Okay. Now, close your eyes for me and tell me when you feel the cotton ball touch your skin, okay?
Feel.
Okay?
Feel.
All right, I'm going to do your legs as well.
Okay. Feel.
Okay?
Feel.
Awesome. Now, if you could, I'm going to check these reflexes in your patellar reflexes. Loosen that guy. Okay. Perfect. All right. Skin looks good on the lower extremities. No edema. Are you feeling any pain in any of your joints down here? Okay, great. Go ahead and assess your pedal pulses. Okay, +2 in the left, +2 in the right. I'm going to do the posterior tibialis. Great. You wiggle your toes for me. Perfect. I'm going to check your cap refill. Each of your toes, less than 3 seconds. Perfect. Now, Courtney, also could you, while I'm thinking about it, hold your arms out for me for 10 seconds. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Perfect. I'm going to go ahead and have you lay back real quick for me, do some strength in your lower extremities, okay? Have you raised your legs for 5, okay? Just the right one. 1, 2, 3, 4, 5. Awesome. And we'll do this one. 1, 2, 3, 4, 5. Now take your right leg out and move it to your right. Okay, perfect. And we'll do the same with the left. Awesome. A little sore. And we'll bring your right leg as far as you can up towards your abdomen, okay? Perfect. We'll do the same with the left. Awesome. You can sit up for me. We're getting there, I promise. All right, Courtney, I am going to have you close your eyes. I'm going to place an object in your hand and you tell me what it is, okay? Key? It is a key. You nailed it.
And rubber band.
Yes, it is. Okay. Now I'm going to bring out my tuning fork again. I'm going to make this vibrate, and then you're going to tell me what you feel and when it stops, okay? So go ahead and close your eyes for me.
Vibration. Stopped.
Okay.
Vibration. Stop. Vibration. Stop.
Perfect.
Vibration.
Okay, awesome. Now we are going to do a little sharp and dull exam. So first I'll just tell you this is sharp,
Okay.
and this is dull.
Okay.
So maybe close your eyes and tell me which one you feel, okay? We'll do it on your face first.
Dull.
Okay?
Sharp.
Okay.
Sharp.
Perfect.
Dull.
Okay. Here.
Sharp. Dull.
Awesome. Great job. All right, Courtney. I am now going to have you stand up for me real quick. Okay. Now, if you could, I'm just going to kind of check your gait, so just take a few steps forward towards me. Perfect. Now go ahead and turn around. Do heel to toe steps for me. Awesome, awesome. Now turn around and face me again, and touch your toes. Great, great flexibility. Now I'm going to have you close your eyes for me. Okay, just checking for any swaying with the Romberg test, and you did awesome, so you can open your eyes for me. Are you having any dizziness or anything? Okay, perfect. Let's see. All right, Courtney, do you have any questions? Okay, awesome. This concludes the complete physical assessment.